up mga kapiti? Nandito na naman tayo sa isang panibagong episode na sure ako na marami na naman kayong matututunan. So for this episode, we will be discussing a case study about a condition na tinatawag na lateral epicondylitis or otherwise known as the tennis elbow. And after that, pag na-discuss na natin yung case study is gagawa naman tayo ng differential diagnosis about sa condition na to. So, wag na natin patagalin and let's proceed. Okay, so ang title ng case study na nahanap natin about lateral epicondylitis is Dry Needling, a case study in treating tennis elbow. Ang author ng case study na to is dalawa, which is M.A. Wymore and D. Blackington. Sila ay occupational therapist sa West Texas Rehab Center sa San Angelo, Texas, United States. Okay, so for the purpose of the case study, lateral epicondylitis, or commonly referred to as tennis elbow, is a common orthopedic injury that hand therapists all over Texas encounter every day. So tennis elbow is thought to result from overuse of the extensor carpi radialis brevis or ECRB muscle. Tendinosis can be a difficult injury to get better from, as there is no one treatment that works for patients universally. According to D. Smith et al. 2007, a recent demographic study described the epidemiology of this condition and investigated its risk factors in a sample of 4,783 people. Prevalence in this group was 1.3% and did not differ between male and female, with the range in the age of 45 to 54 years. Repetitive movements and forceful activities were also positively correlated with lateral epicondylitis. It is the experience of occupational therapy authors in this study that when traditional methods of bracing, modalities, cross-friction manual therapy, eccentric loading, and home program stretching do not work, that there might be another option, that it is not always considered by occupational therapists. So the purpose of this case study was to look at how dry needling could help a patient that was not getting better from traditional or conservative occupational therapy services. Okay, so for the methods, a 61-year-old African-American female with a history of left non-dominant lateral elbow pain for 5 months. The pain started slowly and progressively got worse. The individual worked as a stationary desk job for 8 hours a day and did martial arts as her primary hobby. She reported that her condition was getting worse, so she asked her primary family medical doctor to attend therapy. She has been in traditional occupational therapy services for 9 visits over a 2-month period for the following traditional treatments, and it includes 1. Activity modification, 2. ECRB stretching, 3. Cross-friction manual therapy, 4. Forearm muscle mobilization, 5. Eccentric loading, and 6. Elbow counter force bracing. So at the start of the occupational therapy, the patient had the following objective measurements. 8/10 pain at the lateral epicondyle with activity, full active or passive elbow range of motion, grip strength for the right 55.1 and for the left is 45.7. Quick dash was 9 was 27.5. Positive tenderness for palpation at the lateral epicondyle region. And lastly, positive for resisted middle finger and wrist extension tests. So, at the conclusion of the patient's 9 visit, parang napansin ng occupational therapist na parang hindi na gumagana sa kanya yung conservative treatment. And so from there, naisip nila yung thought na i-refer yung patient sa isang physical therapist for dry needling. The patient was seen in physical therapy for 6 treatments over a 55-day period. And dry needling was added with traditional stretches and activity modification that the patient already had learned with the occupational therapy department. So, bago ang lahat, i-discuss natin muna kung ano nga ba ang dry needling. So, according to Dunning et al. 2014, dry needling refers to the insertion of thin monofilament needles without the use of injectate. Dry needling is typically used to treat muscles, ligaments, tendons, subcutaneous fascia, scar tissue, and pain for the management of a variety of neuromusculoskeletal pain syndrome. Okay, so for the results, initial physical therapy evaluation. For the DASH score, 25.83. Visual analog scale for pain, 72 millimeters or moderate pain. 0 to 10 numeric pain rating scale, 6/10. Wong-Baker Faces pain rating scale, hurts even more. Grip position 2 with elbow at 90 degrees. For the right, 38.7, and for the left, 35.3. Grip position 2 with elbows at 0 degrees. For the right, 44.7, and for the left, 33. And patient tested positive for middle finger and wrist extension resisted test. Now for the discharge results. For the DASH score, 0. For visual analog scale for pain, 1 mm or no pain. 0 to 10 numeric pain scale rating, 1/10. Wong-Baker Faces pain rating scale, no hurt. Grip position 2 with elbows at 90 degrees, right 47.3 and left 49. Grip position 2 with elbow at 0 degrees, right 47.3 and for the left 45.7. And that patient also tested negative for the middle finger and wrist extension resisted tests. Okay, now for the conclusion, after 6 additional visits with the use of dry needling, the patient in this case study was able to significantly improve objective and subjective measures. There is no widely accepted treatment for lateral epicondylitis, and therefore, multiple treatment techniques must be considered. A therapist must have multiple tools in their toolbox for treatment of this condition, and we would like to suggest that occupational therapists can be open-minded about the possibility of dry needling as a treatment technique. Dry needling can be helpful for many upper extremity myofascial dysfunctions and overall improve our clients' ADL or IADL participation without pain or compensation. So last but not the least is yung differential diagnosis natin for lateral epicondylitis. So ano-ano nga ba ang mga other conditions na nag-share ng similar symptoms or characteristics para sa natulad sa lateral epicondylitis, and paano natin sila ma-differentiate? So for first, radial tunnel syndrome. For radial tunnel syndrome, para ma-distinguish natin siya is first, pain in the posterolateral area of the forearm. Pain sometimes spreads to the dorsal side of the wrist. Paresthesia. Weakness. Ayun lang po. Next is posterior interosseous membrane syndrome. Pain. Weakness involving wrist extension and finger extension. And motor deficit. Next naman is yung elbow osteoarthritis. So ano-ano nga ba siya? Pain and loss of range of motion. For the fourth one is the fractures. ang mga distinguishing factors niya is distal radial fractures, radial head fracture, and olecranon fracture. And last but not the least is cervical radiculopathy. So, ang mga symptoms niya na madidistinguish siya is first, radiating arm pain corresponding to the dermatomes, neck pain, paresthesia, muscle weakness in myotome, reflex impairment or loss, headache, scapular pain, and lastly, sensory and motor dysfunction in upper extremities and neck. So ayun guys, doon na nagtatapos yung episode natin, and sabi ko nga for our introduction is marami na naman kayong matututunan and i-assure ko yun. So ayun nga, sana dahil natapos nyo yung episode na to is marami kayong natutunan, especially about sa condition natin na lateral epicondylitis or otherwise known as tennis elbow. So ayun guys, thanks for watching again and peace out.